Dear members of the board, dear audience, Assalamu alaikum wa rahmatullahi wa barakatuh. We are gathered here today to discuss about the importance of establishing a mental health curriculum at the Al-Muntazir school. The first question that I'm sure all of you are asking is, what's the need? What's the need? I mean, we all know mental health is a big buzz these days. Everybody's speaking about it. But how bad is it really? Well, I'd like to take you first up to my first study. And I would like you to ignore the other really surprising numbers of increases in the rates of non-fatal self-harm among girls. We've got ages of 15 plus and we've got ages of 20 plus. But the age group that I would like the audience and the judges and the board members to focus on is our middle school age, which is the ages of 10 to 14. You will note that the rate of non-fatal self-harm among kids in our age group has gone up by almost 189%. That's a 3 times increase over just the course of a few years. So, what's the use? Why should we be incorporating mental health into our curriculum? Case number 1, suicide. According to the CDC, suicide is the second leading cause of death among children, teenagers, and young adults. Members of the board, I ask you a question. What use is a good secular education if that child does not live to properly utilize that education? Point number two, sorry. The onset of mental disorders at a young age. 1 in 12 children between the ages of 6 and 17 are already diagnosed with a mental disorder. As we know about mental disorders, and as we know about any disorders or any disease, the earlier you catch it, the easier it is to fix. And so, if we are able to incorporate the mental health into our curriculum, we will be able to encourage students to identify disorders themselves, or no, to rather at least be able to go and seek help from professionals. They can hence identify disorders easily. Members of the audience, members of the board, I ask you a question. What use is a good secular education if due to anxiety or due to depression, our students are not able to make full use of their proper talent? Third point, the risk of substance abuse. Every single year, our school conducts a whole seminar, a whole festival on encouraging our students to stay away from drugs, marijuana, beer, we've got cocaine, heroin, all the worst things in the world. And we have such a big focus on these substances. But we always forget mental health. We have ignored the very critical and very real link between the fall of mental health and the rise of substance abuse. Members of the board, I ask you a question. Is it worth spending all these resources in looking after our students' risk of substance abuse while totally ignoring their mental health? Definitely is not. Those funds, those resources are wasted if we ignore mental health. Now obviously, as with anything, and as has been the problem that we have been discussing all day today, there are concerns with introducing this topic to middle school students. These are 10-year-old students, 11-year-old students. So what are these concerns? Number 1, the risk of incorrect self-diagnosis. It's a very real risk, yes, for sure. And incorrectly diagnosing something could lead to you going and finding medication for yourself. And kids would love to do that. They don't like troubling their parents. And obviously that could lead to incorrect treatment. But you know what? I'll tell you this. If our teaching is good enough for our students, that we are able to, rather than tell them to teach, we tell them to encourage professional help, we'll be helping them. And secondly, and I think this has been a matter of discussion all day, knowledge leads to more mental disorders. Honestly, this is a myth. Research has actually gone and shown that speaking about mental disorders and teaching kids about mental disorders and giving them a professional to go and speak to actually leads to them having less problems with mental health. Members of the board, I address you directly now. I would like to plead to you that we need to introduce a mental health and wellness curriculum into our syllabus. It is the most critical thing for our students. Because there is no point in having a good secular education when kids die too young. There is no point in having a good secular education when kids suffer from anxiety and depression and are not able to take full advantage of their talent. There is absolutely no point in having a good secular education if our kids suffer from substance abuse. Assalamu alaikum wa rahmatullahi wa barakatuh.
My question to you is, by establishing the curriculum, how long before you know if this is working for or against?
Excellent question.
System that you put into place.
That's an excellent question. So I think firstly we need to acknowledge the failure of our school in frankly ignoring mental health and its concerns through all these years. I would say let's give it a timeline. Let's look at 5 years. Let's make a 5-year plan. Let's start introducing the mental health into our curriculum, and we see results from there. But with that, as my plea has shown, we need to invest in not just our curriculum, but also we need to increase our total resource allocation as well. So we need to start doing surveys within our own school. That's how we'll be able to see results. And then we can track it every year at the board meeting, and we can see how progress is being made. So let's give it a 5-year plan. That's what I would say.
Saqlain, I have a question. On the slide where you discussed your concerns, the second point said knowledge leads to more disorders, and I think the verdict you gave was research shows the opposite. Speaking with a trusted person can help mitigate issues. My question to you is, mental health is a big taboo in the society, especially the youth try to run away from it. How sure are you that if we do incorporate this in the curriculum, so this is a question from a board member to you, if we do incorporate this in the curriculum, how sure are you that the children will not self-diagnose but have the courage enough to actually go to someone and discuss this kind of a problem? What do you think how will you guide these students not to be ashamed about this disorder and go and talk to a trustable person?
So, excellent question. I think firstly we need to give them somebody directly to go and speak to, instead of just saying find somebody to speak to. That's a very important point. Probably hiring a school psychologist would help that. Without that secondly then, who is society? Where does society come from? Where have the ideas of society come from? Frankly, it's come through upbringing. You know, as you're growing up, you're absorbing everything that you're being taught. So at our school, if you incorporate this into the syllabus, rather than just having a one-off event, which is obviously what we're discussing today, if it is incorporated into our syllabus, that taboo will go away by itself. Because society is, children growing up.
Okay, Murtaza bhai, quickly.
I'd like to just add to that. Advise the board, how do you think we could develop trust between the teachers, or first develop a curriculum for the teachers to be able to understand mental health, but also build trust between teachers and the students so that we can we can create an impact on mental health.
So it's a two-part question. Number one being that teachers how can teachers develop trust, and number two, how can teachers be trained? Thankfully, we've got people who are perfect for that. We've got Brother Shabir Khalfan, who runs through Krafia. They run a very good program on mental health. So we can have all our teachers getting trained under Shabir Khalfan to learn this program. And we can have further trainings as well. Maybe you can make it a yearly thing. Secondly, how can we build trust? Well, I'll tell you this. I think we're trying to use a hammer to try and cut a box. It won't happen. Teachers are there to teach. Yes, some teachers can get through to students, and some students will be comfortable sharing things with teachers, but not everybody. That's why, as I come back to the previous question, we need to invest our resources into hiring a specific psychologist, a trained, qualified psychologist, to sit in our offices and have students come to her or come to him. That way, so you're not conflating that relationship between a teacher and a psychologist. The teacher is not a psychologist and will never be a psychologist. He's not been trained for that purpose. When a psychologist has studied for a decade at a uni and has practical experience, that's the best person to handle the issue.